Hey, good morning to everybody. It's Daryl here. It is 11 a.m. here in Connecticut on the East Coast. This is kind of a special video. I wasn't planning on doing one, but I've come across some downright scary information. Let me start first of all with the report now that this year 5.4 million Americans have lost their health care insurance. This is more than any other time in the history of America. This is 40% more than lost their health care insurance back during the Great Recession back in 2008. Back then, it was around 3.6, 3.5 million Americans. Just this year, 5.4 million Americans lost their health care insurance. Now, here's the unbelievable part. Right now, Trump is still going to the courts to do away with Obamacare, which would strip another over 20 million people of their health care insurance in the middle of a pandemic. All right. Let me mention this. I've been talking to you guys about my hip replacement surgery. Today makes exactly 1 month since I had surgery. The typical hip replacement surgery costs about $35,000. If I didn't have insurance, that would have probably bankrupted me for the rest of my life. Probably and that's just the basic surgery, not counting the doctor's visits, the medication, the physical therapy. It probably would have come to over $50,000. I don't know how would anybody pay for something like that. All right, I could already hear Trump supporters, the self-centered, selfish, typical Trump supporter. Well, that's not my problem. I got health care insurance. Who cares? Hey, it's everybody's right. If you don't want health care insurance, I shouldn't be forced to have health care insurance. This is America. I could choose. I don't understand how some people could be so short-sighted. Okay, let's go over this. For the people that do not have health care insurance, for whatever reason, if you lost your job, if you just say, hey, if you're an American, like I just said, like a Trump supporter, and you don't want health insurance, you just decide you don't need it, you're healthy. All right, let's go over this. Well, how is this going to affect the average American that does have health care insurance? Let's think about this. If you don't have health care insurance, and say you needed a hip replacement, people that don't have health care insurance are going to wait because they don't have the money. So whatever is ailing them, be it a disease, a sickness, be it arthritis like I had, they're going to wait, which means it's going to get worse. The condition will get worse. That's a fact. These diseases, arthritis, stuff like that, doesn't get better. It gets worse. The end result would be that you're going to have a lot more unhealthy people, a lot more people having much more serious conditions than they originally would have. So what's going to happen then? Where do these people go? Eventually, they're going to need treatment. Like with me, I wouldn't have been able to walk anymore. What about somebody with the COVID virus? Eventually, they're going to have to get treatment. And I remember back when I was a drug addict and I didn't have health insurance, where are you going to go? You're going to go to the emergency room. That's the only choice, or a walk-in center. Somebody that's going to treat you regardless of you having money or health insurance. That's where people without health insurance end up going. And by this time, their condition has gotten much worse, and it's going to cost much more and take much longer to treat it. So, who ends up paying for that? Come on, this is a simple question, guys. Even Trump supporters can get this. If you can't pay for it, you go to the emergency room and then you get the bills. You ignore the bills because you don't have the money, you don't have health insurance. What's going to happen? This is how we end up with Tylenol. 2 Tylenol end up costing $120 when you get a hospital bill. This is when a pair of crutches ends up costing $650. This is this money has to be made up somewhere. Where do you think it's going to be made up? This is where we get the exorbitant healthcare costs. Eventually, everybody's going to end up paying for it. These Trump supporters who think, well, it's not my problem. Yeah, it's going to be your problem. Your bills are going to go up. Your deductible, it's going to come out of somewhere. It will come out of somewhere. Your doctor bills, your hospital bills, eventually you're going to end up paying for it. Somebody's got to pay for it. It's not to anybody's advantage. If when people opt out of having health care coverage, it's it might be your choice, but it's a stupid choice. It's like choosing to drive drunk. You might get away with it for a while, but it's going to bite you in the ass. I mean, come on. This is simple stuff. It's common, common logic. Now I'm getting to the scary stuff. I was just reading about this. The Trump administration has now ordered, beginning today, that hospitals no longer report the COVID-19 data, the new infections, the deaths. The Trump administration is ordering that the hospitals and all the healthcare places do not report this to the CDC, where they have been reporting it for public dissemination, for researchers, for everybody. Instead, the Trump administration is ordering that all the hospitals, all the information collected now goes to the White House, to the Department of Health and Human Services, which is overseen by the Trump administration. Do you see where this is going? As the Trump administration tries to downplay this, can you see what's going to happen here? We're no longer going to be able to get available data on the new infections, on the deaths. The Trump administration is trying to take control of the daily data of infections. This is scary. Like I've told you guys, I go to World Meters, very reliable, non-political page that has all sorts of information. Not just on COVID-19, but on everything, on daily births across the world, daily deaths, how many newspapers are sold. It's a great site, World Meters. So I'm wondering, will this affect World Meters? If all the information if the Trump administration is now requiring that this information now goes directly to them, why would they do that? It's not going to be to anybody's benefit, but except for people that are trying to alter or hide the data. This is terrifying. I didn't think it was possible. Just like I said, just when I think that the Trump administration has hit the height of corruption, of anti-American, unconstitutional behavior. It's another day, and we have stuff like this. I'm going to leave the links down below. This is something that truly scares me, and it should scare you guys too. The Trump administration is ordering that they're taking control of all the information on the COVID-19 infections, and daily deaths, that they get all this data first, to do as they will, to disseminate as they see fit. They're trying to take control of the information, the knowledge of how bad this pandemic is, the trends and where it's going. This is truly scary. I just wanted to get this video out there once I was sure that it was the truth, and I am sure it's the truth. Like I said, I'll leave the links down below. This is an issue. Like I said, and it scares me, and it should scare other people too. All right, you guys have a good Wednesday.